Welcome to all our guests. We're so glad you could join us. And to introduce our presentation, Carmen Hughes, the Executive Director for Hybrid Solutions, will take lead on our webinar today.
Thank you so much, Phoebe. So good afternoon. Good afternoon, everyone, and a huge thank you to everyone joining us in our monthly educational webinar today. We are thrilled, so thrilled that you have carved out time to attend. And this session is a bit different and a bit straight from our normal regulatory content. We thought we'd do something a little more spicy today. We also thought it was important and interesting to share as it relates to some new work we're doing here in High Bridge and the National Center for Primary Care, NCPC. So today you'll be hearing from myself, Phoebe Nelms, our Associate Program Director, and our newest team member, Ashley Barfield, who serves as our Education Coordinator and Program Coordinator for the division. So many of you, I should say, are regulars on our monthly webinar, and so we thank you for that. But according to my list, I do see a few new participants, so I want to share just a bit with you about who High Bridge is. So Hybrid Solutions is known as Georgia's Health IT Center. We've been assisting clinicians really across the state of Georgia and beyond with federal and state incentive programs that promote interoperability through the use of successful EHR technology. So for instance, we were the Regional Extension Center. We worked with Meaningful Use, promoting interoperability both on the Medicare and Medicaid side. We were the translators of that information to you for meeting the criteria, those requirements, as well as the quality payment program, and we're still working with those quality payment program actually today. We're located on the campus of the prestigious Morehouse School of Medicine in Atlanta. We're within the National Center for Primary Care. We also call it the NCPC. And as a reintroduction, I'm Carmen Hughes. I serve as the Executive Director for the Center's Health IT Division, alongside our Executive Medical Director, Dr. Dominic Mack. So in keeping with the focus of our Health IT Division and Health IT technology, we recently were invited to participate in an AIM Ahead project funded by the NIH. And so AIM Ahead is an acronym for a mouthful, Artificial Intelligence and Machine Learning Consortium to Advance Health Equity and Research Diversity. And so the AIM Ahead program is really designed to improve the health of the nation by ensuring that AI and ML fields include diverse and underrepresented communities in data and AI and ML researchers to mitigate the risk of creating and continuing harmful biases and how AI and ML is used, how algorithms are developed and trained, and how findings are interpreted. So that's a mouthful, but I want to make sure I read it from the NIH. But there is certainly untapped potential within underrepresented communities to distribute this new expertise, this data, this recruitment strategies, and really the cutting edge science around AI and ML, making sure that information gets out to those who may not normally have access to the information. So again, we're sharing with you, and hopefully you will share with others. So with that, Phoebe, I will turn it up. Nope, I have one more to talk about. I want to talk about the objectives. We talked about the AIM Ahead program, but the objectives of our time today will be really threefold. We want to describe what AI is at a high level and how it's been used on a daily basis in daily lives. We want to list a sampling of current AI applications, and again, a sampling of AI applications used to support healthcare and health decision making. And we also want to investigate challenges and opportunities for AI in healthcare. So we have an action-packed few minutes for you, so we appreciate your attention, and certainly I hope you find it to be interesting. That in mind, I will turn it over to Phoebe to talk more about the artificial intelligence with an overview for you.
Thank you so much, Carmen. And thanks for pointing out that this presentation will be a very high level treatment of the question. We've had conversations with some of the experts on the AIM Ahead project who are very experienced data scientists and clinicians who have done deep, deep, deep work on this. We just want to provide an introduction and an overview and get people curious as to how they can get involved and make a difference. So this question, artificial intelligence, what is it? Before I started working on this Aim Ahead project, I was like, what did I know? And so Ashley, let me bring you into the conversation and ask you this. Before you started working on this project and researching artificial intelligence, specifically around healthcare, what did you think about when you heard the term in general, artificial intelligence?
Well, I grew up watching movies that shaped my idea of what artificial intelligence is, like the examples on the slide. Um, in the Avengers Age of Ultron movie, artificial intelligence was seen as more of a threat to society and not something that could benefit humans.
Interesting perspective. And Wall-E, my kids love that one. He sort of over his time in solitude on Earth developed human-like intelligence and seemingly even emotions over time. But many people, I believe, have been influenced, or perceptions have been somewhat molded by the Hollywood productions that have shaped our view and really created a communal consciousness around the topic. Is it realistic or not? Well, at the very least, through these media, we've been exposed to the idea that artificial intelligence can assist us with all kinds of tasks and perform analysis rapidly, and even create simulations that can help us tackle some very complex and meaningful problems. On the next slide, we have a short video that was created by the Aim Ahead Consortium, and I think you'll really enjoy it. It sums up our focus today, AI in healthcare, very nicely.
Artificial intelligence is changing your world. You interact with it daily, whether it's advertisements that are personalized to you or when texting on your phone. AI predicts what you will say next. Artificial intelligence is a lot of things. It's natural language processing, speech recognition, machine learning, and much more. Machine learning is a popular subset of AI, where algorithms are developed that have the capacity to learn and improve on their own. There are endless healthcare applications of AI. Robotic surgery is utilizing machine learning and machine vision to help improve surgery. And now, AI is being used to train the next generation of doctors through virtual reality simulations of medical procedures. Voice-activated assistants and AI chatbots are using speech recognition and natural language processing to serve patients while reducing workload on healthcare providers. All of these applications utilize large amounts of data. When people think about these emerging technologies, they often don't realize that they rely on large data sets. The problem is, these data may be biased. Certain groups are underrepresented in the data sets and underrepresented in the researchers creating AI applications. Underrepresented groups also suffer greater health disparities and inequities. Health equity means that everyone has a fair and just opportunity to reach their optimal health. If we promote more equitable use of AI in healthcare, we can save lives. To close the gaps in the field and to better engage underrepresented communities, the NIH has launched the Artificial Intelligence Machine Learning Consortium to advance health equity and researcher diversity, Aim Ahead Initiative. Aim Ahead hosts and organizes programs and events such as the Aim Ahead AI for Health Equity Symposium, which brought together a diverse group from industry, academia, and the community to discuss these exact issues and strategize on how we can come together to solve them. By engaging in trusted partnerships, Aim Ahead enhances the participation and representation of researchers and communities currently underrepresented in the development of AI and machine learning models, and to improve the capabilities of this emerging technology. The Aim Ahead Coordinating Center is funded by NIH. These initiatives are just the beginning. We call on you to get involved, share your voice, your passions, and your ideas. Join us and ensure that the future of AI in healthcare serves all of us.
I really enjoyed that. Thank you so much for sharing that.
Artificial
And based on that was a lot of information, but what were the main points that you got out of that, Ashley? How would you summarize it? What is
Well,
artificial intelligence?
what I gathered from the video is that artificial intelligence combines computer science and large data sets to copy problem-solving skills and decision-making capabilities of the human mind. Machine learning and deep learning are subfields of artificial intelligence. Artificial intelligence uses algorithms, which are a set of well-defined steps or rules that need to be followed in a specific order to perform a task, and all computers use algorithms.
All computer systems use algorithms. Wow. So that means, since most of us interact with computer systems on the daily basis, even to use Zoom to attend this webinar, we interact with AI daily. And here are some examples of AI at work in our lives every day. And truly, it's hard to be aware of all the ways that we interact with AI daily. For example, AI is a critical part of what makes Google Maps or Waze work to help us navigate and avoid traffic jams. Netflix also uses AI and machine learning to study the watch history of customers and match with the preferences of others who have similar tastes. And even in the financial sector, banks are using AI to transform the customer experience by enabling frictionless 24/7 customer service interactions. So even though we may not often think of it because it happens in the background, artificial intelligence is being used all around us to support efficiencies and services. And as mentioned in that video, it can even be used to save lives when applied in healthcare. So our next question is, how is AI impacting healthcare?
Well, in general, it's being used to advance the training and research, diagnosis through early detection, and contributing to wellness programs. In our next slide, we will learn about specific examples of how AI is being used in healthcare.
Okay, so yeah, there are apparently very wide range or variety of ways in which it's being used successfully in healthcare systems today, from, as you mentioned, detecting diseases to assisting surgery. AI applications are revolutionizing modern medicine, and it can even make the most repetitious, tedious jobs on the administrative side of healthcare easier and reduce burden on those in healthcare settings. And it also can make documentation easier. Because it can automatically collect and store clinical notes for physicians during a visit by using voice to text technology. So then that frees up the clinician to actually give their focus to the patient. In a Cleveland clinic in Ohio partnered with IBM by using AI to gather information from medical health records and use that to personalize the healthcare plans for each patient on an individual basis. And a recent Mayo Clinic study shows that AI algorithms are programmed to analyze patterns of changes in women who are in labor and predict positive or negative labor outcomes based on the individual labor characteristics of the patient, which gives the clinician an opportunity to intervene. So AI is being used in healthcare to also improve surgical performance. In 2017, an AI-assisted surgery robot was used to operate on extremely small blood vessels at the Maastricht University Medical Center in the Netherlands. So I think we have coming up a poll question because we want to get you involved. And just to see if you're engaging with us, how is AI being used in healthcare? Early diagnosis, predictive models, research to identify best treatment protocols, chronic disease self-management, all of the above. Just take a few seconds. We'll give you a little time to enter your responses. Thank you all so much. Excellent. So on the next slide, Carmen, would you please be so kind as to discuss some of the many potential uses for AI in healthcare that are being worked on and explored?
If I come off mute, I'll be happy to do that. But thank you all for the poll question, answering the poll question. Great information. And yes, all of the above, you're all correct. And that's in some of the ways that AI is being used in healthcare. So thank you for that. So as we think about other potential uses, AI can be used to, we found some examples we want to really share with you. The first one's really on detecting heart and lung diseases. The Mayo Clinic is advancing the detection of heart diseases and complications by applying AI technology in the ECG, the electrocardiograms. And the Mayo Clinic has already been able to demonstrate the use of AI with a small digital stethoscope that was designed by Echo that can record the sound of a patient's heartbeat and record an EKG of the heart's electrical activity. NIH also funded this project, I just want to mention, and another project for Echo to develop an algorithm that will detect pulmonary hypertension and rate its severity using the data gathered by these digital stethoscopes. So that's a great example of how it's used, and I think we have a little video to kind of demonstrate that as well from the Mayo Clinic.
This souped-up stethoscope shows artificial intelligence in action.
This is where it records sound, and I have it connected to a smartphone.
The stethoscope not only digitally records the sounds heard by Dr. Paul Friedman, it also records an electrocardiogram of the heart's electrical activity. The data is run through a neural network, a computer system trained by crunching hundreds of thousands of sets of similar readings so that it becomes expert in looking at a focused problem.
It gets to a point where it gets very good at seeing very subtle patterns.
The result is a simple test that can read current heart conditions and, using those subtle patterns, predict possible future problems.
Within 15 seconds, you have some of the skill of an expert cardiologist in your pocket.
Dr. Friedman says this type of artificial intelligence in diagnosis is the way of the future.
We have plans to expand it to hopefully prevent people from walking through our hallways, having a weak heart pump and having it undetected when there are things we could do about it.
For the Mayo Clinic News Network, I'm Jeff Olson.
Thank you for sharing that, Ashley. And so that's one way. And then we also want to share with you another way through cancer detection. We know that future AI technologies could detect cancer in patients before it progresses. And in 2017, Standard created an algorithm to identify images of skin cancer. And the algorithm was trained to scan over 130,000 skin disease images and then diagnose those for potential cancer accurately and quickly. The Nature Medicine journal published a study of using AI-trained algorithms to detect lung cancer. The algorithm was trained with the past CT scans of patients before and after the diagnosis of lung cancer, and it was completed with 6 radiologists and outperformed them in detecting lung cancer. So again, the computer and algorithm to direct person interchange, not to take away positions, but to validate. Researchers from Oregon State were able to detect genes responsible for breast cancer using AI. So again, some additional examples, and I'm going to turn it over to Ashley to really talk about maybe mental health, how AI is used in the critical area of mental health.
Well, in the future, AI could play an important role in advancing mental health care for people who need it. Advancements in AI mental health technology can improve the detection of diseases and accessibility of mental health services. Dr. Allison Darcy is a clinical research psychologist who designed a virtual therapist program called Wobot. This program is shaped by clinical research to treat patients as an instant messaging service for your mental health. Wobot is designed to assess symptoms of anxiety, depression, and other mental health needs and respond with coping strategies. The University of Southern California's Institute for Creative Technologies has designed a virtual therapist to treat veterans suffering from depression and PTSD. Exposure therapy aims at providing relief from post-traumatic stress. And on the next slide, there's a video that will explain more in detail about how virtual reality exposure therapy can help treat patients and help them conquer their fears.
There's such a growing demand for mental health services. All the while, the number of providers in the world has remained relatively flat. My name is John Sockel. I'm co-founder and COO of Limbix. We make apps and VR for treating mental health disorders. We chose virtual reality because we saw probably 20 years worth of research, maybe 300 peer-reviewed publications that had showed VR play some sort of meaningful role within mental health care. Within cognitive behavioral therapy, there is a technique called exposure therapy. And exposure therapy is the idea of flooding someone with the thing that causes them distress. So a really simple example could be if you're afraid to drive or couldn't get behind the wheel.
So this is the Limbix headset.
Once that therapist knows that you're ready and comfortable to do this exposure, the therapist might start you off on a quiet street. And so you're in your virtual reality headset as a patient. And as the therapist next to me, as I'm going through this as a patient, all the while sees what I see in VR on their tablet.
What we have here is the tablet interface.
And on that tablet, they can choose that quiet street. They can also choose a busy road like a highway or a tunnel or something much more anxiety-inducing like a bridge. And so the therapist will slowly but surely gradually expose me to more and more stressful environments. And then while I'm viewing these and going through that, that therapist is also teaching me coping techniques to be more comfortable with what I'm doing and things that I can apply to my own life when I'm actually in the car afterwards. There's much more serious examples around PTSD and other phobias as well, where exposure therapy can be really helpful.
It's the 21st century exposure therapy. It's as close as you can get to real life without going into real life. And the data shows that it works as well as going into real life. So for therapists, it's a beautiful tool.
It's critically important, we think, to take them through a rigorous FDA process. The alternative that people have done to date is basically making direct-to-consumer apps. You don't want to send people on their own at home to do things that could potentially make them worse. And so in the last couple of years, the FDA has rolled out a new therapeutic class called prescription digital therapeutics. And basically, the FDA is now attempting to evaluate apps the same way that they evaluate drugs. Make sure that the apps that doctors and others are providing have some sort of basis of evidence that they work. But really, it's about trying to provide lots of access for lots of different problems, because ultimately we want to make these treatments available around the world. I think the way we improve access to these treatments is with cost-effective technology that can be democratized around the world.
Thanks for watching. If you like this video, give it a like and subscribe to FreeThink Now for more great videos every week.
And now I will turn it over to Phoebe to talk about metabolic diseases.
Wow, that was really interesting. Yeah, I really like that one. Yeah, so other potential uses for AI, in addition to behavioral health, as an adjunct to your visit with a therapist, they can be used to monitor metabolic diseases. Wearables really can help patients to manage their chronic conditions, such as diabetes, at home, especially with the use of continuous glucose monitors. Patients can monitor their glucose levels without the constant use of finger sticks, and it can enable behavioral change in the patients. With continuous biofeedback, patients can monitor right then and there which foods and which activities affect their glucose levels. And so they can adapt and adjust and make changes to their daily routine, which would prove to be very advantageous. It could also be used to address the obesity epidemic, as we'll see on the next slide. As AI technology progresses, it really does have the potential to address the global obesity epidemic, because there are so many genetic and lifestyle factors that can cause obesity in an individual, as you see demonstrated here on this slide by all these colorful circles. A trained computer may be able to use these factors, do an analysis, and predict an individual's risk of obesity. And so this can then be used to help someone make lifestyle changes that prevent the onset of obesity. And also, in addition to that, the development of AI mobile apps offers ways for patients to manage their weight. These apps can help by tracking the progress of the user's weight loss, calorie intake, amount of physical activity, and even recommend possible meals to meet the patient's health goals. So by using the patient's electronic health information, the apps can make informed suggestions to the patient to manage their health and it be ongoing in their daily life, not just when they go to see a clinician. Another potential use for artificial intelligence in healthcare is to assist with the development of new drugs in their design and screening them and repurposing them for maybe off-label applications that have not yet been discovered. And all of this is with the objective and the goal to save lives. It is currently, AI, being used for COVID-19 drug discovery and vaccine development. And it can remove some of the steps in the drug testing, analysis, and that whole process, which can sometimes take up to, on average, 13 years, and speed up the process by analyzing compounds that could be used for as drug treatments. AI can be used in drug designing, screening, and repurposing, as we said. And it can speed up the discovery process, again, with the goal of saving lives. But, you know, in addition to all these potential positives and great uses, and it's exciting to contemplate where this could go, there are some pitfalls around the use of artificial intelligence in healthcare that we need to consider. Aren't there, Carmen?
There are, and I'll talk a little bit about the pitfalls, and along with the benefits of using AI in healthcare. Of course, there are the pitfalls we just mentioned, and so we just said they were. And so, if we think about what they look like, there's a use of already biased data to train the software algorithm as a pitfall, because sometimes the data going in is biased, so therefore the algorithm will lend itself to be biased. A software algorithm that contains no bias itself in the algorithm, but has been a biased design or organization, that could be the case. And certainly a software algorithm is incorrectly applied and thus produces a bias. So again, just some high-level pitfalls that could really impact the use of AI in healthcare. So as we think about strategies to address the pitfalls in AI, there's some things that we want folks to consider and things that come out through the AIM program. We want to raise awareness about bias via seminars and programs such as this, and to get more in depth in some of the other research that's out there. Ensure fairness in the AI algorithm. Develop outreach programs to encourage students. So, train the trainer programs and STEM programs, et cetera, for algorithms. Mentorship opportunities, which we'll talk a little bit more about specific to this program, but there are many out there. And then foster team diversity and inclusion for AI and development, a very important strategy.
The next generation, they're the ones that are going to really need to take on this mantle of making sure that AI is not biased. And the more diversity we have, and even patients' voices are important to get into this conversation about how we can avoid those pitfalls. And they have great ideas, as we discovered from our research project on this, interviewing clinicians and patients. So our poll question, let me be quiet. What pitfalls do we need to avoid when designing AI tools? Well, we want to make sure that we don't use biased data to train the algorithms, and that the organizations that are creating the AI doesn't have bias, and that we don't inappropriately apply certain algorithms in a way that creates bias. So thank you so much. 100% correct. Okay, so since it's so important that everyone get involved and that we want to reach the goal that the Aim Ahead project has set of really increasing the diversity of the researchers and the scientists and the clinicians and the educators and the policymakers, healthcare workers, community-based organizations, even patient advocates. We want all of these people to get involved because your voice is important and can make a difference in this burgeoning area of science and discovery. So anyone can make a difference. Everyone can make a difference. Clinicians, healthcare staff can help by being open to adopting AI systems into their practices, those that can relieve the administrative burden and also help with diagnoses and other things. And by giving feedback to the developers, they can use the knowledge that they've gained through their daily interactions with their patients and their medical knowledge to help identify those priority health issues that need to be addressed and that could possibly benefit from the application of artificial intelligence. And working with AI program developers to give them feedback and also input and advance the use of AI in healthcare in a way that benefits and saves lives. So how can you get involved? You're not a computer scientist, and you may not be directly yet involved in AIM Ahead, but it's an open invitation. Anyone can get involved in AIM Ahead efforts to increase diversity in AI ML research and in also ensuring that the data that's used to develop and train AI systems is complete and accurate. So we encourage you, one and all, please use the information on this slide to join AIM Ahead Connect. It's a dynamic website that's constantly improving and adding more features, and we really encourage you to check it out. You can join AIM Ahead Connect also if you have an interest in research to connect to diverse mentors, and you can become a mentee. Anyone across the country is welcome. You can subscribe to the AIM Ahead newsletter to stay updated with their initiatives at aimahead.net. And so one last poll question for you. Did you learn anything new about AI in healthcare from our presentation today? Awesome. So glad to hear it. Very grateful for that response. And so as we have come to the conclusion of the information we wanted to share with you today, we have a few additional slides regarding our way that you can contact us and also our other learning opportunities that take place. We do a webinar once a month on the third Tuesday of each month, and on the second Tuesday of each month, we have a webinar that is focused on those who need to report for and participate in the Quality Payment Program, those who care for Medicare beneficiaries and reach a certain threshold are required to report to the Centers for Medicare and Medicaid Services, and we support them. Social media contacts, feel free to reach out to us. We wanted to see if anyone had any questions. We're glad that you joined us, and we'll share our contact information on the last slide so that you can reach out to us directly if you have a question or you'd like additional resources or a list of some of the references that we pulled our research from today. But not only do we provide this sort of outreach and education directly, we also partner with ForMed Approved because we know that many clinicians and healthcare professionals are required to gain those CEUs, continuing education credits, throughout the year. And so we've partnered with ForMed to offer your a discount to continue getting your education training. It's great for HIPAA compliance and those who have to do the HIPAA training every year. Something coming up that you may be interested in is the Health Information Management Society, Systems Society conference, which will take place in Chicago this year on April. So anyone that's interested in health information management, it's a wonderful event, so much to learn. And of course, we mentioned your invitation to join AIM Ahead Connect. They also offer free courses that you can take advantage of to learn more about artificial intelligence and machine learning and connect with mentors and so on?
I took the unconscious bias course and learned a lot about how to be aware of my own bias and how it affects my behavior and decisions every day. It's pretty short and it's very interactive, and they even gave me resources to help me be an advocate for others.
Oh, wow, that's interesting. I'll have to check that out as well.
Me too. That's great. Thank you.
So here's our contact information. And please feel free to reach out to us if we can be of service or provide any additional information or connect you with someone at Aim Ahead that can meet your specific needs or inquiries. We thank you again for joining us, and we hope you have a fantastic rest of the day.